Hey everybody, the goal of this video is to give you a general overview of some different shoulder pathologies and kind of point you in the right direction as you begin your rehabilitation journey from a shoulder injury. So to start this, we're going to talk about the two major buckets that we're going to hope to fit you in by the end of this video to get you started. So the two major buckets that we're going to break this down into are either a bony shoulder injury or a muscular shoulder injury. Okay, so throughout this video, kind of be thinking which one of these symptoms kind of most correlate with my pathology to figure out which regimen to next circle to. So let's talk about some of the anatomy of the shoulder joint. So to start, we have the humerus or the arm bone, which articulates with the scapula or the shoulder blade on the backside. The two bones come together to create what's called the glenohumeral joint or the true shoulder joint. This joint oftentimes is referred to as a ball and socket joint, or oftentimes referred to as like a golf ball on a tee. So we don't get a whole lot of bony stability from this joint. We get most of the stability actually from the connective tissue and the musculature around the shoulder joint. So when we talk about the muscles around the shoulder joint, the most common area of pathology is actually the rotator cuff muscle. So the rotator cuff muscles are a group of 4 muscles that all start on the shoulder blade and articulate onto the humerus. So picture that kind of golf ball on a tee. We have 4 muscles that start from the shoulder blade and kind of insert onto the golf ball. They work to kind of pull that golf ball into the tee. So they work to kind of give that shoulder a little bit extra stability. Again, we don't get a lot of stability from the bones themselves, so we're getting most of that stability from the rotator cuff muscle. In addition, we have something called the shoulder labrum. The shoulder labrum is a fibrocartilaginous ring that goes around the scapula. So if we think back to that golf ball and a tee analogy, the labrum is a ring that goes around the tee in the golf ball like a tee analogy. It works to deepen the socket and add a little bit extra support on the shoulder joint. So breaking the shoulder joint down into different pathologies can be a pretty complicated thing to do efficiently. So we're going to try to see if we can correlate your symptoms to either a bony pathology or more of a muscular pathology. With a bony pathology, oftentimes we see the pain described as more achy in nature, and it usually comes on a little bit more gradually over time. However, we might also see muscle injuries come on gradually over the time in the cases of like a rotator cuff tendinopathy. Some of our biggest differentiators from there are going to be, do we kind of run into like a harder block as we're moving our arm through our full available range of motion? Oftentimes my patients who have shoulder osteoarthritis, as they elevate their arm, are going to feel like at some point they're kind of running out of range of motion and it just feels too tight to go much beyond a certain point. With my patients with more of a muscular pathology, as they elevate their arm, they might feel like a sharper kind of catching pain at a certain point, but if they keep pushing through that pain, they're able to usually get that full range of motion. So oftentimes we see a limitation in what's called passive range of motion in a bony shoulder pathology, but and also a limitation in active range, versus in a muscular pathology, we see painful active range of motion, but we're able to get fully through it, which means we have more of a full what's called passive range of motion. The difficulty here is that it's not always that simple. We sometimes have bony and muscular pathologies kind of on top of each other. So the biggest thing to differentiate here is, whether you have more of like a bony pathology or a muscular pathology, there's going to be some carryover in the treatment. Additionally, we might also have a sudden onset shoulder injury, and this is going to be in more of the cases of like a falling on an outstretched arm, or from throwing a baseball maybe a little bit too hard, something like that. So sometimes in those cases, we see more of like a sudden onset, like rotator cuff tear. We might see a fracture or a dislocation. If we suspect those, certainly kind of refer to your primary care physician or your orthopedic physician to kind of point you in the next direction. If your symptoms have come on a little bit more gradually, this is a great place to start.